Hello, I want to take this opportunity to thank the organizers of this camp for coming up with such an important idea to see patients in communities like this. My name is Dr. Mayanja Ahmed. I am an orthopedic surgeon by profession and specialization with a bias in spine-related diseases. During our assessment since morning, we have seen a number of patients. The majority of them have come with diseases that are related to degenerative conditions of the spine. It is important that such activities are introduced into this community, in communities like this. One reason that we need camps like this and many more is that one, orthopedics is one of the subjects that are misunderstood not only amongst the professionals but the communities. We always have a competition between the professionals like us and then the traditional bone setters and traditional doctors that treat orthopedic related illnesses. So the knowledge and attitudes of our people are quite low. So it is important for us to participate in camps like this so that we help the community. The other thing is that most of the orthopedic specialists in Uganda are concentrated in the urban settings, and there are very few in community hospitals, or almost none. So it is usually a disservice to people of the communities of our settings, especially in the villages, because they cannot access the services. One, they are expensive, and two, they are far away. So during our assessment, we have found orthopedic conditions related to degenerative diseases, specifically degenerative conditions of the joints, the knee, the hip, and the ankle. We have found a number of patients with back pain, patients who have spinal stenosis with the gross inability to move. So some of them, we have managed them with the first-line painkillers, because most of these conditions can actually be managed using non-operative means, first-line medications. But many of them need supportive therapy in form of physiotherapy. Unfortunately, we did not come with a physiotherapist, but we have been teaching patients on some of the physiotherapy strategies that can be home-based, that can help relieve their back pain, their knee or hip pain. And we think that we have changed the attitudes and knowledge of so many of them. We have seen conditions related to infection. Some of them we have referred them. We are going to follow them up in bigger hospitals so that we can see how to help them. The others with minor joint pains and back pain, we have managed to give them medications, and we hope that they are going to get better. We have seen some children with the deformities, and we have seen some adult patients with the malunions. And the reason that they have most of these is that they have been managed by traditional bone setters, whom majority of them do not know the principles of management of limb fractures. So as a result, many of them do actually help the patients to unite, but the limb function in many of the aspects is grossly affected. And this is because most of the people actually do not know, they do not have adequate knowledge about the management of conditions like this. I have had an experience with one of the patients, for example, who has back pain and he has full-blown symptoms of spinal stenosis, who saw a community medical officer who told him that the condition can only be managed in India. He was disappointed and he has been living with a lot of disability. So such a patient, we have been able to screen him out of the community, and we are going to follow him up and see how we can help him improve his functional status so that he can live a productive life once again. So we are continuing to see more and more patients, and we know that there are a lot of conditions in the community. We have had also experience with the infections. In the communities, most of the bony infections are referred to as a talo. And many of them live with the children who continue to spill pus out through the sinuses of skin, which is an indication that the infection is in the bone. And if you hear the community discussion, they keep saying that this is a traditional disease, and they do believe that traditional diseases must be dealt with using traditional means. And that is how many of our children and adults have become incapacitated from orthopedic-related infections, because majority of them actually do not have adequate knowledge about management of such conditions. So we have been able to teach or to provide health education and information about many of these diseases and how they can be managed, and where the different categories of patients and people can seek medical help. We have also provided our numbers, phone numbers, for those who might need urgent help, so that we can follow them up personally and with this organization and see how we can make their lives better. I want to thank you, and I want to thank the organization for coming up with such an idea. And I want to pray to the Almighty God to bless everyone who has put in an effort to reach such a very important medical need to the community of this place. Thank you.